Pain during menstruation, often referred to as period pain or dysmenorrhea, is a common experience for many women and people who menstruate. But should periods hurt? Is pain an inevitable part of the menstrual cycle, or does it signal an underlying problem? To answer these questions, it's important to understand what causes period pain, when it might be a sign of something more serious, and what treatments and medications can help provide relief. At the most basic level, periods are a natural process. Each month, the uterus prepares for a possible pregnancy. If no pregnancy occurs, the lining of the uterus, called the endometrium, sheds and exits the body through the vagina. This is what constitutes a period. For some, this process happens with little discomfort. For others, it brings days of cramping, aching, and sometimes even sharp pain. Mild cramping or discomfort is considered normal for many. It's the body's response to chemical signals called prostaglandins, which trigger the uterus to contract and help expel its lining. These contractions are similar to, but much less intense than, those that occur during childbirth. The pain can vary from a dull ache to severe cramps that interfere with daily activities. But not all pain is normal. Severe, persistent, or worsening pain may indicate an underlying medical condition. Understanding what is normal and what might be a cause for concern is essential. There are two main types of period pain: primary and secondary dysmenorrhea. Primary dysmenorrhea refers to pain that is not caused by any other medical condition. It typically begins a year or two after a person's first period, and often decreases with age or after childbirth. The pain usually starts 1 or 2 days before the period begins, peaks within 24 hours, and subsides after 2 to 3 days. It is usually felt as cramping in the lower abdomen, but can also radiate to the lower back and thighs. Secondary dysmenorrhea, on the other hand, results from an underlying health problem. This form of pain often begins later in life, after years of painless periods, and can worsen over time. It may last longer than typical period cramps and might not respond as well to standard treatments. Common causes of secondary dysmenorrhea include endometriosis, adenomyosis, uterine fibroids, pelvic inflammatory disease, or the use of certain contraceptive devices like copper intrauterine devices. Endometriosis is a condition in which tissue similar to the lining of the uterus grows outside the uterus, leading to inflammation, scarring, and pain. Adenomyosis occurs when the endometrial tissue grows into the muscular wall of the uterus. Uterine fibroids are non-cancerous growths in the uterus that can cause heavy bleeding and pain. Pelvic inflammatory disease is an infection of the reproductive organs, often caused by sexually transmitted bacteria. Because period pain can have different causes, it's important to pay attention to your body. Mild to moderate cramps that respond to over-the-counter medications and don't disrupt your daily life are generally considered normal. However, pain that is severe lasts longer than your period or is accompanied by other symptoms like heavy bleeding, irregular periods, pain during sex, or infertility should be discussed with a healthcare provider. When it comes to treatment, the approach depends on the severity of the pain and its underlying cause. For primary dysmenorrhea, lifestyle modifications, home remedies, and medications can often provide relief. One of the most common treatments is the use of non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen or naproxen. These medications work by blocking the production of prostaglandins, the compounds that cause uterine contractions and pain. Taking NSAIDs at the first sign of your period, or even starting a day before your expected period, can be particularly effective. Applying heat to the lower abdomen, such as with a heating pad or hot water bottle, can also help relax the muscles and reduce pain. Some people find relief from warm baths or gentle exercise, like walking or stretching. Staying hydrated and avoiding caffeine, alcohol, and salty foods may also help minimize bloating and discomfort. Certain lifestyle changes can make a difference too. Regular physical activity, maintaining a healthy weight, and managing stress have all been linked to reduced period pain. Some people benefit from practices like yoga, meditation, or deep breathing exercises, which help the body cope with stress and pain. For those whose pain doesn't respond to over-the-counter medications and home remedies, hormonal birth control methods may be recommended. Birth control pills, patches, injections, intrauterine devices, and implants can regulate or even suppress periods, thereby reducing or eliminating period pain for many users. These methods work by thinning the uterine lining and decreasing the amount of prostaglandins produced. If secondary dysmenorrhea is suspected, treatment focuses on the underlying condition. For example, endometriosis may be managed with hormonal therapy, pain relievers, or surgery to remove the abnormal tissue. Uterine fibroids might be treated with medications, non-invasive procedures, or surgery, depending on their size and impact. Pelvic inflammatory disease typically requires antibiotics to clear the infection. Some people turn to alternative and complementary therapies for period pain, such as acupuncture, acupressure, dietary supplements, or herbal remedies. While some individuals report benefits, scientific evidence for these treatments is mixed. Always consult a healthcare provider before starting any new supplement or alternative therapy, as some may interact with medications or be unsafe in certain situations. It's also important to recognize when period pain needs medical attention. Seek help if you experience sudden, severe pelvic pain, pain that gets worse over time, periods that become much heavier or last longer than usual, pain during sex or bowel movements, or symptoms like fever, vomiting, or unusual vaginal discharge. These could signal conditions that require prompt evaluation and treatment. Tracking your menstrual cycle and symptoms can be helpful. Many apps and calendars allow you to record the timing, duration, and severity of your pain, as well as any associated symptoms like bloating, mood changes, or gastrointestinal issues. This information can help you and your healthcare provider identify patterns and potential causes, making it easier to find effective treatment. In summary, while some discomfort during your period is common, pain that disrupts your life or feels different from what you've experienced before should not be ignored. Most period pain is caused by the body's natural processes, but sometimes it's a sign that something more is going on. With the right approach, whether it's medication, lifestyle changes, or treatment for an underlying condition, period pain can often be managed or even eliminated. If you're struggling with period pain, know that you are not alone. Millions of people experience this each month, and there are many options available to help you feel better. Don't hesitate to talk to your healthcare provider about your symptoms. Open communication is key to finding the best solution and improving your quality of life. Remember, your period should not be a time of suffering. Mild cramps are normal, but severe or persistent pain deserves attention. Understanding your body, recognizing what's normal for you, and seeking help when needed are all important steps toward better menstrual health. In the end, the answer to the question, should periods hurt, is that some discomfort may be normal, but significant pain is not something you should have to live with. There are effective treatments, supportive communities, and dedicated professionals who can help. By learning more about your options and advocating for your health, you can take control of your menstrual well-being and live your life with less pain and more confidence.